Hello, I'm Dr. Sundari May, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. As of April 28th, we have 222 confirmed cases, up to in the last 24 hours. 117 of our cases are active, 103 have recovered, and we still have the 2 deaths that we reported. We have now performed 5,482 tests. Today, I would really like to share with you the results of the second phase of the modeling that the Imperial College of London has completed for Sonoma County. As you know, phase one had predicted that potentially we would have a surge by the end of May or early June, and that we might see, without any mitigation factor, up to 10,000 hospitalizations. However, it appears that shelter in place, thanks to all of you in the community, has been extremely effective in flattening the curve. In other words, we have really limited community transmission by simply staying at home and observing all of the other guidance that we've been giving from the county. Now, the phase two report demonstrates that the county shelter in place order, combined with the other interventions that include contact tracing, the targeted testing strategy, face coverings, social distancing, congregate living guidelines, that all of these have suppressed the virus transmission to a really great degree. So all of our mitigation strategies combined have been extremely effective so far. Based on our actual data, we can see that our shelter in place and the other mitigation strategies, but primarily shelter in place, reduced our transmission rate, what we call the R naught, or the reproductive rate of 2.5, by 75%. And what that means is we would have expected, without any of these mitigation strategies, that every person with COVID would infect another 2.5 persons on average. However, with the 75% reduction that we've achieved through our shelter in place, one person actually, it seems, is not even infecting one other person, but rather, if you look at the actual data, 0.625 persons. So all that means is we've done a very effective job of limiting transmission from one person to another. So we are doing a great job. We need to stick right now with shelter in place and abide by all the other orders that we've put out, as they are working and working quite effectively. Now, what else does the phase two report tell us? The phase two report also tells us that the timing of shelter in place hugely impacted the amount of hospitalizations and the total number of cases, and also deaths resulting from coronavirus. We put our shelter in place order into effect when we just had a handful of cases and we did not have any widespread community transmission. That actually really helped us quite a bit. So we're seeing far fewer hospitalizations and deaths than some of the other counties that had a lot more cases when they started their shelter in place. Now, you may be asking, well, do we have to shelter in place for good? No, absolutely not. In fact, we are planning on a phased gradual lifting of shelter in place. And when we do that, intensive testing, as you know, we had been doing this last weekend, we started with healthcare workers that are both symptomatic and asymptomatic. This intensive testing strategy to find cases and isolate persons with COVID quickly, and also identify their contacts and get them quarantined and followed closely. This strategy is really going to help protect us from a resurgent wave of infection. So what we need to do then is widely test, which we have started to do. As I said, we're starting with healthcare workers, but then we'll move on to first responders. After that, we will be going to our older and vulnerable populations and the essential infrastructure workers, and we'll be testing people who are symptomatic throughout our community soon through the public health department and our clinic partners. So we will make this testing more widely available, and this will help us achieve the strategy of minimizing the impact of a resurgence as we slowly begin to loosen our shelter in place restrictions. Without having a vaccine in place, herd immunity, or getting a majority of the population, 60% of them, immune to the virus, will be really difficult to achieve without allowing transmission to spread through the community. So these intensive testing efforts really need to be maintained until we have a vaccine. We now we're testing about 200 to 250 persons a day, but with the help of our clinics, we are going to scale and get to 600 to 800 tests per day in the coming weeks. Let me remind you that if you're a healthcare worker, you can call 707-565-4667 to make an appointment to get tested. And we'll let people know as we move through different portions for testing, who will testing and how you can get tested in the weeks to come. So thanks to all of you for the part you're playing in implementing these effective measures to reduce COVID-19 transmission in Sonoma County. And I know that our successes come with great courage, sacrifice, and hardship for many of you Sonoma County residents. So here's a few community questions. What's happening after May 3rd? We will be extending the shelter-in-place health order this week and giving much more details on how we are going to be loosening certain sectors and areas. And the other question, can you please open up the parks? Well, I'm happy that you asked that question. We will be easing the restrictions to parks and plan to share more information later this evening in the town hall. So thank you for joining today. Take care of yourselves, stay healthy, and I will see you again tomorrow.